It is my pleasure and my privilege to be your moderator for this first session of this year's European Health Forum Gastein. It's 25th anniversary conference, and I think very aptly, the first session on the agenda focuses on the workforce. As all of you know, one of the crucial building blocks of health systems, one of the crucial ingredients for service delivery, one of the key functions of health systems, are health professionals in their different disciplines. So what we really want to do is try to make sure that we safeguard their well-being and their mental health, and we're going to talk about where we are with that in this session and where we could do better and do more. Without further ado, we have a lot planned for the next hour and a half. I would like to invite on stage our two speakers who are here with us today. So we have Sidalia Eusebio, who is a member of the European Health Parliament. This session is co-organized with the European Health Parliament. And Sidalia will share with us her experience today. And we have Natasha Azopardi-Muscat, who is the director of the Division on Country Health Policies and Systems at the European Office of the World Health Organization, and she's going to join us in a second. We also have two wonderful speakers online. We have Matej Vinko from the National Institute of Public Health of Slovenia. He's the head of the program on mental health. And we have Fanny Laura Mentala, who is a mental health advocate and an expert by experience, which is a lovely descriptor, I would think. We also have Norbert Kuspel from the European Health Parliament, who will join us a bit later and present to us the recommendations of the European Health Parliament on this very important topic that we have today. The rules of the game for today are that there is several of us here. This is great to see after 2 years of digital sessions. But we do still have our digital participants or hybrid participants, so there's more of us joining today than what we can see here in the room. And I say this for those of you who are in the room because it is going to look a little bit different than what it looks like when it's just on site. So we're going to be looking at our screens and looking in the cameras and not actually looking at our colleagues who will be appearing on the big screen behind me. So it might look a little bit antisocial, but that's the way of the game nowadays. What we want also to ask you to do is to interact with us to the best of your abilities. We try to make this as interactive as possible and use Slido to do so. So you can see or could see or have in your documents the QR code to join Slido and ask your questions, and our online participants can do the same. So what we will be doing during the session is collecting these questions from you here and from our online participants, and then we have one of our young Gasteiners who will bring us the summary of the points made and interact with our panel later on. So without further ado, I think we can start. Keep your ears open and your minds open. We start with Sidalia. Sidalia, thank you very much for coming. You bring your experience as an ICU nurse with you. You bring your experience as a consultant from the private sector with you. You bring your experience with the European Health Parliament with you, so lots of hats. Our main focus today is really the mental health and the well-being of the workforce. So where are we with that? If you want to share with us your thoughts about how our workforce is doing currently.
Yes, thank you for having me. It's a real pleasure to be here today. I think we all know that the health and care workforce is really in critical condition. We see shortage of healthcare workers across many countries here in the European Union, but also in many other countries of the world. We see also, obviously, a dilution of the skill set because you don't have those staff members, and obviously that also has impact on the accessibility of healthcare, for example, as in rural areas as we see today. But obviously it's not just about that, it's also about retention. We can see that people are not staying in their jobs. And myself as a healthcare worker, I also left my clinical role. And obviously all of this and considering the pandemic as well has created really the perfect storm for us to, to have the situation that we have today. And that's why we are here talking about this. And obviously, health and care workers have spoken about it, and 1 in 3 wish to leave their clinical role, and about 30% of nurses, I would repeat, 30% of nurses are considering leaving the bedside care, and they are not just considering, they are actually leaving. So that's why the European Health Parliament and the future-proofing health systems, as well as the well-being of healthcare workers, put so much emphasis on the key pillar of health systems, such as the workforce.
Very, very well put. You bring in your own experiences. You mentioned as an ICU nurse, 1 in 3 nurses are leaving or considering leaving. You left. Describe perhaps for us, before you left, your daily routine as an ICU nurse. What was your day as an ICU nurse like?
So if, for example, you go on the Google and ask and put an image of ICU nurse, you'll probably find a smiley nurse walking a wheelchair and supporting a patient. Actually, our work day is not like that. It's very complex and it requires a lot of complexity of skills. It takes about 1 to 2 to 3 years to actually properly train as an ICU nurse in a very expertise area. So our day is basically three key areas that we work on. We lead the patient care, the management of patient care. We also do the management, the coordination of the unit, and we also educate and train not only healthcare professionals, but also patients and their families. By leading healthcare, the patient care, I mean by doing the handovers, monitoring, assessing the patient constantly, monitoring all the drugs and infusions and machinery that we use. That requires quite a lot of technical skills that take a lot of time to acquire, but also, the psychological part. So we support patients and their families going through this roller coaster of being in ICU, which can be quite complicated. They have, depression. They can become delirious and affects their quality of life. And that's what our role is. And also management, coordination of the wards, but also educate. But really my vision is really to try and do much more than that. I think nurses could have much higher impact on bringing research to create more evidence-based care, using the data and using innovation methodologies to actually change the way that we work and also improve the economic impact by reducing costs and improve care.
Thank you very much. I think this is already quite interesting thoughts about skill mix and evolution, which we can bring back, I think, later on in a very constructive way. I think what you described makes it very clear this is a very taxing job. This was taxing anyway with the pandemic, I can imagine, with the different volumes in patients and the whole situation around it even more so. If you think about that in conjunction with mental health, what would you say are the root causes of poor mental health among the profession, based on your experience?
I think they are multifactorial, obviously, but I think the working environments has a detrimental impact at the moment, because I can tell you a story of my colleague, Anna, obviously it's a different name, that works in a neuro ICU in London, and over the last 2 years, 80% of the workforce of the nurses left the ICU. What does this impact Anna? It impacts in many different ways. Impacts because you have very diluted skill force that is not prepared to look after patients, because the ones that you're replacing that don't have the skill set that you need. It impacts because you can't create the teams and the psychological safety to raise concerns and raise patient issues, and also learn and educate. And obviously it impacts on your breaks, because you are concerned that you cannot leave those nurses alone, and you can't relieve breaks, or you can't take holidays because there is a dilution of staff, or actually you have to take more rotas of extra work without getting paid, like what happens in Portugal at the moment. So, there's a lot of things going on that impact. But I also think that career progression and also opportunities are a major factor for the mental health well-being. But obviously, the pandemic has really increased the PTSD, moral injury, and a lot of ethical dilemmas, because the workforce was really, really diluted, and we've really seen a lot of very difficult moments, really.
So can I summarize that in being working conditions, but also financial recognition for the work, but also career progression, and in a way also fulfillment in your work based on what you expect and what you don't expect? more or less?
Yes, I think it's to keep it simple, start with the basics. So if you have really good conditions by having good ratios of workforce and really good skill set, align that with the economic impact, because obviously, as we know from the Health Foundation, they've raised the alarm that we're not getting paid as we should be at the moment. So, I think if we start with the basics, we'll get things right.
Okay, this is already a very important point, because what we would need to consider, I think, is the extent to which current policies consider these elements. So do you think that the way we treat the workforce currently reflects all these needs?
I think from what we've done at the European Health Parliament, what we ask is for much more accountability from the policymakers in acting and having a task force to actually put in the agenda the workforce. I think that's key at the moment if we really want to take into account the problems that we're seeing at the front line, and we want to retain more staff. So yes, but obviously there is a lot of policies in place, but obviously we need a little bit more encouragement so they can be acted upon and implemented effectively.
Okay, thank you very much. We come back to this point of actually triggering change, effective change, later on in the session. The very last point before we go to Natasha, who has put the workforce on the agenda. Would you consider going back to the ICU?
So at the moment I'm on a career break, which is great. I think I'll go back to ITU just as a temporary professional, just to enable my financial sustainability. But my aim really and my purpose, and that's why I study my master's in public health, is to really bridge the gap between the evidence, the policy, and the data, and the health service to really innovate in healthcare and really implement the change. So that's what I'm aiming for. But I hope, my aim and my vision is that nurses could take more opportunities in terms of career progression, not just operational, but much more research-based. And actually those initiatives that are, for example, the clinical academic careers we have can be actually implemented at the hospital level.
So if I put it even more simply, what would need to change for you to consider going back into a full clinical capacity?
I think a lot of things, but one of them I think is having also a word and the chair. We need leadership as well from the nursing and many other clinicians. I think we lack of leadership at the moment. I think things are changing slowly, but I also think that we need a seat at the table. What we've seen across the world is that nurses don't have a seat on the table. Healthcare workers don't have the seat on the table to make those changes and to highlight those problems, because clinically we are looking after the patients. We are not thinking about the policy at the policy level.
Okay, thank you very much, and hold on to a couple of these, or at least a couple, for the second part of the session where we really think about the tangible solutions. Thank you very much, Dalia, also for sharing your personal experience. I think there are some of us here who are former clinicians or trained as clinicians but are working in different fields, so I think it will be really interesting to see how others relate to the story that we heard. One of the main points, Natasha, I'm coming to you, that Sedalia just made was the importance of putting the workforce on the agenda. And you are the director of the Division on Country Health Policies and Systems. You put the workforce on the agenda very firmly with your recent workforce report that you presented at the regional committee. So you have a really bird's eye view of how our workforce is doing in so many different settings. What is your takeaway messages from your recent report that really speaks, I think, to a lot of the challenges in the workforce?
Thank you very much, Dimi and Sedalia. Spot on, but a number of points that you raise I could even respond to immediately. But let me just say congratulations also to the EHFG for having decided to open this year's session with this theme. Why? Because every single member state across the European region, irrespective of size, irrespective of level of GDP, whenever our regional director, Dr. Hans Kluge, goes to meet the ministers, they have one concern: the health workforce. Money is always a concern, but at the moment, what is keeping them awake at night is that they simply lack the health workforce. But worse still, health workers are leaving, and many of them are leaving because of their poor mental health. The pandemic did not help this, and we know that actually at the peak of the pandemic, there were countries that surveyed nurses where 8 out of 10 nurses were thinking of quitting. But the issue is that the elevated levels of anxiety and depression remain, and the more we have health workers who have had to take time off, also because of long COVID, there's a fireside chat later this evening on the topic, the more we have gaps in the system that continue to place pressure on those remaining. This was very clear when we set up a technical advisory group on the mental health impacts of the pandemic, very early into the pandemic, where we were told by our expert advisory group, hey, the health workers are particularly at risk and we need to focus on them. And that is, I think, when we really started feeling the need to place a lens on the health workforce. Tomorrow, my colleague Thomas Zapata will present the findings from our report that covers 53 countries across the region at 11 a.m. But let me just fast forward to say that we put 10 actions, and one of the 10 actions is, in fact, to work on the mental health and well-being of the health workers, because there is no way that we are going to be able to retain the current health workforce if we don't actively work on their mental health. But also, and more worryingly, what we are seeing is that even young health workers are either qualifying and choosing not to work, or else after a short while they just cannot cope and they burn out. So the good news is that at WHO Euro we have also prioritized mental health in general. We set up a pan-European mental health coalition working on 6 different work package areas. And one of the areas is, in fact, for example, mental health at the workplace. And later on this week, we will be issuing guidelines on promoting and protecting mental health at the workplace. And of course, this is very much applicable to hospitals, clinics, and the other settings that health workers work within. But also, last year we had adopted a framework for action for mental health. And again, over there, it's about the way in which we provide services. Why is this important? This is important because many times what we see is that when we refer to the theme of stigma, within the health services itself, within the health workforce itself, we often stigmatize mental health. So what do we need to do? First and foremost, we need to prevent. We need to ensure that during their training, health workers are equipped with the necessary individual resilience. Why? Because the health sector is a difficult sector to work in. So without even entering the merits of shortage of staff, of a pandemic, of a backlog of waiting lists and care that now needs to be dealt with, just even placing that aside, we know that the health sector inherently is one of those sectors where your mental health could be under strain. So we need always to have initial and continuous support for prevention. This could also mean being alert to watch out for early symptoms of stress and burnout. Second, we need to protect. We are very good, or we are quite good, at protecting our health workforce physical health. During the pandemic, we gave everyone masks and visors and special face masks and PPE, and we made a great show of protecting our workers' physical health. But did we do anything? Did we do enough to protect our health workers' mental health during that very difficult period? There were a couple of countries that actually did implement some very innovative and promising practices, for example, in Ireland, and there were others. But by and large, this is an area that is neglected. In the same way, we advise our health workers to protect themselves physically. We need also to ensure that we are able to protect their mental health. And this is not only about the individual, it's about the system, it's about the systemic issues, it's about the never-ending hours, it's about the environment that people work within, still very much often a very grueling environment that doesn't even allow for people to rest, to eat properly during those long hours. And third, we need to be able to provide support and care. every hospital, every clinic, every health worker needs to be able to know where they can go, to whom they can speak to have a dedicated stream for support for their mental health. I think for me, this is the recipe, and this is where we need to get to. And what I can say is that because of the pandemic and because of the situation that we are in, we are finding a very receptive audience amongst our ministries of health. Of course, we have to be realistic also that our health workforce in the mental health sector is equally overburdened, overstretched and trying to cope. But I think there is a case to be made for carving out a specific stream to ensure that we provide the services that we need to support the mental health and well-being of our healthcare workforce. I'd just like to reassure Sidaria also that we are working very hard, particularly to empower nurse leadership. So back to back with our regional committee in Tel Aviv last week, we hosted a face-to-face meeting for our chief government nursing and midwifery officers. We have a hub which meets now regularly, and also a number were included in their member state delegations, which for us was very encouraging and very heartening, and is definitely the way to go. And we are also developing a leadership program for the health workforce. So I think that absolutely I echo your pleas, and I'm happy to share that I think that as WHO Euro, we have shown a light on the plight and the precariousness of the health workforce. We say it's a ticking time bomb. We say the time to act is now. And we try as much as we can to come up with practical recommendations. But of course, we also need to listen to you, because you are helping us also to understand what the needs of the young health workers are. And I'll return to this later.
We'll return to that. Thank you very much, Natasha. You also preempted, I think, a couple of my questions. And I think the most important thing, perhaps to also give our participants the clue, is that really on your health workforce report, you can see very clearly the importance of mental health and well-being reflected. And I think, just to reiterate your point, for those of us who are passionate about this issue, now really is the time to press for our policymakers at the national level, at the international level, to actually take action on this. So we come back to that in the second half of the session to discuss how we do that. We go now, after Natasha's really insightful contribution.
I think
yes.
Maybe it goes because it was fantastic.
Go ahead. Now we go to our online speakers. Thank you very much for joining us. We have Matej Vinko, as I said, who will give us the perspective from perhaps one country primarily, but also from the academic side of things. So, Matej, you've worked at the Slovenian National Institute of Public Health, in particular the national mental health problem, on a big study regarding mental health, and in particular, I think, stigma, which we're going to talk about in a minute. But from your academic background and from your experience, what would you say are the main contributors to the poor mental health of our frontline health workers? 1 second, we can't hear you yet. Now, yes, perfect.
Oh, hi. Hello, everyone. Great being in Bad Gastein again, albeit remotely. Many of the things that were mentioned by Sidalia and Natasha as well are really principal contributors to bad mental health of health workforce. I generally group them in 3 dimensions. So the workforce, or the work processes, the workplace context, and thirdly, the individual perspective of a worker. And this is the third one that I think I could highlight a bit more, because it hasn't been addressed that much. And it mainly goes in the direction that each health worker is an individual, a human with previous experience, with its own social, psychological disposition, which means that, we have different needs, different capacities, which might prevent us developing mental distress, mental disorders, or might facilitate this process. And all the different factors act in a nexus that influence each other. It's really hard to separate specific determinants, factors, and address them, as Sedalia already pointed as well. But one thing that should be accommodated are the needs of an individual in his workplace. So I think that's one very important determinant factor that influences mental health. And it really points us to the direction of co-production of the workforce environment. So in collaboration with the workforce, the patients, the managers, I believe that can move us in a right direction when we talk about mentally healthy workplace.
Okay. Thank you very much. I think this is it's a very nice differentiation that you make between the different areas that helps us think about this a bit more constructively, I think. One point that is interesting, I think we come here from the health systems perspective, from the population health perspective, and one of the groups that was also put under significant mental strain during the pandemic, other than our frontline health workers, who are public health professionals. So we focus on the frontline health workers justifiably, but just to not forget that this is a group with a different job description and perhaps with different types of stressors. So what can you tell us about that?
Definitely, and I must say that was also my personal experience in a way, as a public health expert. I think the experience that links the frontline health workers and public health workers is the moral conflict that many of us experienced during the pandemic. So the pandemic was, or is, of huge magnitude. It's long-lasting. And when we think about public health, and we often describe it as an ardent science of preventing disease, prolonging life, promoting health, with combined efforts of society, of whole of society. So in turn, even public health experts were, in a sense, in and outside of the action. What was happening in the society was addressing them very directly, but then again, as it is completely normal, they could not really influence everything. And due to the magnitude of the events, many might have feel guilt, shame, which we then, of course, link with the moral injury, as we know from the experience of the frontline health workers. So I think, albeit in different magnitude, there are some similar experience, and definitely public health workers are not to be left behind in this sense, as even though the burdens and stressors might differ significantly from what frontline workers experience, they are or were definitely put under a lot of stress during past 2 years.
Thank you. I mean, I have to also reflect on my own medical training and public health education are admittedly a while back, but we didn't have any skills training about dealing, for example, with trying to communicate scientific findings and getting hate online, for lack of a better way of saying it. So I think this was quite an experience during the pandemic. So shows us we need to adapt also the types of skills that we need when we train our health professionals. I understand that you had a recent study looking really into the, let's say, challenges or barriers that health professionals face in seeking help when it comes to mental health. Natasha signaled that earlier as well. Often we think about the fact that clinicians are closer to the context. It might be easier for them to get medical help if they need it, but it might be harder for them to get themselves to ask for support in the mental health area. Is that the experience that you've made from your recent work?
Yeah, indeed. We looked specifically at stigma, at mental health professionals, specifically suicide prevention professionals internationally, and mental health professionals more broadly in Slovenia. And well, just to be super clear, what we found that stigma is present, albeit on lower levels than in general population. It's still present in significant amounts or levels in health professionals, mental health professionals as well. Now, why was it important for us to research it? Well, of course, we know that health professionals are trained to help others, and they themselves have high expectations of themselves. So when it comes to them experiencing mental health issues, they might extend their denial of their experiences, their distress. They might feel shame or even be hesitated to ask for help due to fearing of being perceived as less competent because they could not prevent, the mental health issues from happening to them. Bear in mind, we had mental health professionals in our study, or perhaps they were even afraid of losing their license and so on. So this then eventually can lead to a vicious circle of spiral of not looking for help, symptoms or experiences of mental distress worsening, eventually leading to major severe impact on their personal as well as professional life. So in our study, where we included suicide prevention specialists, we found that indeed individuals who had past experience of mental disorder, and there were approximately half of included professionals had past experience of mental disorders, they had higher anticipated self-stigma, and this significantly then predicted as well help-seeking stigma. So what we can interpret from that is that their past experience with struggling with mental disorders hired or increased the anticipated self-stigma, and that in turn increased help-seeking stigma. So I think that's indicative of a systemic problem, as Natasha pointed out. It's a culture of competitiveness and comparison instead of a culture of acceptance and empathy, which we should strive for. And that's, of course, not the only barrier to help-seeking and help professionals, but it's a significant one. One that definitely needs addressing, because although we only studied mental health professionals, it is as well present in all health professionals, as was proven by other research.
Okay, I think this is really insightful. I really like the words you used, so I'm keeping them here as notes to bring back later. What I would like to do now, and thank you very much, Matej, is to go to Fanny Laura. Starting from where Matej left off, like this difficulty in reaching out for help. You are a mental health advocate. You've had experience with mental health from different perspectives, and I think what we've heard is clear. Though the situation might have been improving, there is still very clear stigma associated with people, healthcare professionals, but also people in general reaching out to get support for mental health. Did you have to face stigma in the past related to your experience with mental health?
Yes, definitely. I mean, there is still stigma, like Matej said. There is stigma, there's local stigma, there's a communal stigma all around. There's global stigma with mental health. But I think what proved the most difficult one to break for me was the self-stigmatization that I did to myself. It was a demand to even though I could show compassion to others, if they were struggling, I still thought that I should not be struggling. They might have it more difficult, they might need help, but I should not need help. And this is the stigma, I think, that is still very much ongoing. It helps nowadays. People talk more openly about mental health. we talk about. It doesn't mean you don't have to feel sick. You don't have to have depression in order to talk about mental health, because this was the issue before. I think mental health was the synonym for poor mental health. Today we speak about mental health as a positive force. Also, it's fluctuating. It can be anything in between, and it changes. And we can improve that change. We can self and in community we can improve our mental health, even though we do not have poor mental health. But with me, I think the most difficult thing was to ask for help. I struggled for a long time before I could ask for help, because I thought that I should not need to ask for help.
But you did. You speak very openly about your previous mental health challenges. I think we're very grateful for that. I think what it would be really interesting for us to hear and very helpful would be if you have advice for people who are in this situation where they think about how they can go about it.
I think for me also, it took a couple of years to get my head around, to be more open about it. But what I found out is that when I speak about mental health, when I was struggling, the more openly I spoke about it, the more openly other people also spoke about it. Speaking aloud allowed other people also to explain their experience, to really verbalize their feelings as well. And in that way, we could also see that we're not alone. So what I would advise for an individual is to speak about it, but also for the community to still speak about it, speak about mental health. There are tools and ways to improve mental health. And I liked what Natasha said about preventing, of course, and improving, but also protecting. But this is a crucial thing, I think, what has been with mental health previously is that we always go to speaking about therapies, thinking about how to cure mental health issues, when we should be talking about improving mental health in the daily life. And how do we be more open about the way feelings I mean, all feelings are natural, and it's just the way we need to express them so that we can feel more safe to talk about also the bad feelings, the depressive thoughts, so that it doesn't become such a big barrier that it becomes eventually depression.
And I think you are hinting already at important aspects and elements to safeguard mental health. I was wondering if you can give us a brief insight on how we can apply that to the health workforce in particular before we move to the second part, which is really about triggering change and doing a more hands-on approach. But in general, if you think about your own experience and your exposure to discussions also perhaps with healthcare professionals, what do you think are the most important aspects to safeguard, as you say, proactively mental health, and in particularly linking that to the health workforce?
To understand you're not alone. Everyone goes through difficult times, and ask for help. Ask for help even before you need to have that crucial help asked for. But I also would I would like to impress that it's the responsibility of the employers, the policymakers also. It's not the individual's responsibility to cure themselves. This is not what I'm talking about. Even though it helps to speak about it, therapy is a good way, but not everyone needs therapy. We need to take responsibility as a community, and we need to express this to our policymakers.
Thank you. I think this is quite important. So we need different levels to bring in their own contribution, and we come back to that. Sedalia, I told you that I would bring you in at this point. Bear with me for a second. I think what we're going to do now is go to a video that we have prepared with different young professionals from the healthcare setting who give us a couple of ideas about how we can hands-on advance based on the principles that you all have set out. So we're going to take a look at that video, and then we're going to come back to our group here and discuss this a little bit more in depth. So if I can ask our colleagues to play the video for us, that would be great.
We face a European health workforce crisis, with psychosocial risks on the rise because of poor work design and management. In order to tackle this issue for this group of particular interest, one piece of the puzzle could focus on their management. Organizations should publicly commit to create a mentally healthy workplace by investing and training for a culture of openness about mental illnesses, allowing for a destigmatization of mental health treatment in these work environments.
Whilst multi-level interventions can support the mental health of healthcare professionals, I believe that the workplace itself represents one of the most important contexts for change. Health organizations can and should provide psychologically safe working conditions for their employees. Implementing a mental well-being plan could help achieve this by facilitating the early identification of and consequent action on workplace hazards for mental health, such as increased workloads, unfairness, or other problems in the organizational culture.
My solution to safeguard mental health of the health workforce is that every organization has a support system task force. This task force can create a buddy system, for example, but also monitor what other ways of support employees may need, such as flexible working hours. An independent monitoring body for well-being is the solution.
In our international research, we found that flexible working hours, adequate pay, equality policies that foster an inclusive culture, and better mental health support are key in determining care workers' well-being and how valued they feel. We have also found that strong leadership, coupled with bottom-up approaches that foster autonomy, agency, and control, go a long way in empowering staff and increasing their well-being.
Despite the hurdles and challenges societies and health systems have faced from this pandemic, our healthcare workforce resulted in all of us embarking on hopefully the end of this journey. The increased investment in health to explore paths for the future preparedness for frontline healthcare workers and consider the opportunity to engage healthcare personnel in the political decision-making processes to co-create new policy development, then we can ensure a wider and more actionable dialogue about mental health in the workplace.
Safeguarding the mental health of the health workforce would need to go through a number of actions. First and foremost, the financing should be strengthened and should no longer be considered as an expense, but as the long-term investment it really is. These investments in the workforce should be targeted to recruiting, training new and current workforces, as well as maintaining them through salaries that reflect the work accomplished and a satisfactory work-life balance. The COVID-19 pandemic has taught us that we need to move from applause to action, and we need to move now.
My solution is the solution that ought to be embraced by all of us. We, as politicians, policymakers, healthcare specialists, and citizens, must support and protect our healthcare specialists by providing safe government-wide regulations, optimal education, sustainable jobs, and public prestige for all our healthcare workers.
A big thank you to all our young professionals for contributing. We have several of you here, I think, today, so that is great. Probably reflected also in the contributions that we're going to get via Slido in a minute. We heard a range of different principles, but also concrete suggestions of how to move forward at the policy level, at the organizational level, at the individual level. And so what I would like to do now is briefly come back to our panelists and ask, we want to trigger change. We realize we are in a problem situation. Where do we start? So how can we actually affect change? What's the first thing to do? I will start with Sidalia, because I promised you before. And then we go to Matej online. And then we come back to Natasha and end with Fanny Laura. Sidalia, over to you.
I think it's great that we're starting this conversation, and I'm really glad. That's why, you know, we tried so hard at European Health Parliament to work on the healthcare workforce. So I'm really glad to be here today with WHO and the European Forum Gastein to discuss this theme, which is really important. I think we can start at different levels. I will take an action, you that are on the other side of the camera and many other healthcare professionals here, to take action like I did myself, to get involved and to really raise the concerns and be involved in policy level, so we can start this conversation going and making coalitions and hopefully having a window of opportunity soon. So it takes time, it takes a lot of courage, and it takes a lot of research. And I also would like to highlight research at the economic point of view. I think we really need to understand the economic value of health and care professionals, and hopefully, you know, a little bit more research to help us, you know, raise this important point of investing in the healthcare workforce.
So if we focus on where we start, engage and amplify the voice is what I'm hearing. Research as well, but the first thing you said is really engage and amplify the voice. So I'm keeping that also for further consideration. Matej, we come to you. You gave us quite a nice framework before. Where do we start? What's the first thing to do?
Oh, I would add self-care rounds to morning rounds. So add self-care as a regular work process and consider it as such. I think it's truly important, and it adds to everything we aspired before and we should aspire afterwards. So.
Okay, thank you for that, Natasha. We come to you. Where do we start?
To me, we need to start with some very simple and practical actions that hospital organizations, primary healthcare organizations can take and can feel that they are making a difference, and that send a signal to our health workforce that we care. We care about their mental health and well-being. We may not have all the resources, we may not be able to do everything at one point in time, but at least just acknowledging that we recognize and setting up simple pathways, for example, simple issues where people can feel that at least they can talk, they can reach out. I think this is where we need to start. Of course, measuring and then introducing more systematic safeguards, psychological safety, changing the rostering and all of that, that takes more time. But particularly, I believe that those organizations that start to pay attention to these issues will find themselves in a positive circle of retaining the staff that they have, word travels fast, and attracting staff to join them. This, of course, will be on the agenda of our high-level meeting planned for next March on health workforce. We haven't planned the program yet, but I can tell you that one of the sessions will definitely be about the mental health of the health workforce.
So if I understand correctly from the policy side, figure out a way to support organizations in supporting their workforce. Okay. Fanny Lara, last but not least, as well in this round as in the previous round, where do we start?
Normally speaking about mental health, improve mental health and resilience, and protect mental health and resilience before we need to restore it and cure, and also lower threshold to asking for help. Ask for help, and also when you ask for help, please, it would be important to get help, because this is also something that people struggle with. When they ask for help, they don't get help. So
I think really important distinction, ask for help and make sure that people feel comfortable asking for help, but also that they are able to get the help, that if they reach that point where they do ask for it. I think this is really important and reflects also on things like Natasha said, supporting the organizations, but also some of the solutions that we heard in the video, like a task force or a guardian. And this brings me to our first interaction with our audience. So I see on the right-hand side here, there's quite a bit of activity on the Slido. Josephine also live in the room, not only in the video. Can you give us a summary of what's been going on from our audience participation, online and in the room?
Of course, thank you very much. So a lot of questions, so I've tried to summarize and also make some decisions as to which questions I am going to raise. First of all, to summarize, some of the contributions are asking, shouldn't we make mental health a priority in health system design? And shouldn't also we be looking at a broader scale as to maybe systems are too disease focused, and this is also participating in this issue with the the health workforce. Other suggestions concern investment, and I know this was being addressed very quickly, how we need to make the case that investing in health workforces is actually going to create growth, and it should not be considered as a burden or a cost. And another contribution was about how we should address this issue at the local level as well, and not just have a top-down approach. But to ask some questions, one of the questions that was raised by the participants is, in which countries are there good programs for better working conditions for instance, the nurses? What are best practice examples, and how could we scale those best practices maybe throughout Europe? So I know this might be a question for Natasha here. Thank you.
Natasha, if you want to take this question, just to say any of our panelists can weigh in if you have insights, and I get back to you in a moment. Natasha, over to you.
Thank you very much. So yes, nursing is one of the key areas of priority. It's the largest workforce. It's also a workforce that is upskilling and developing. And we see very diverse experiences from across the region. For example, one of the things that we have done at the moment is we have just published a technical brief that shows the role of nurse leadership. And it's amazing, it's astonishing that some countries, of course, are really moving forward and are able to show that they are giving nurses a voice and that nurses are advancing, whilst other countries are still really lagging behind and cannot even identify a nurse leader at a senior policy-making level. So that is just one example from a quick mapping that we carried out around nursing leadership roles. And then when you start digging down, again, we see a lot of encouraging examples where some countries, for example, are really improving nurse education. I think the most encouraging aspect is that we are seeing more and more countries acknowledging the importance to change the practices, the educational pathways, the career pathways for nursing. We are seeing more countries engaging with us and telling us, can you help us because we want to make a change? And I think, of course, WHO is very small, we have very small units, but we are very privileged and fortunate that we work through the efforts of so many collaborating centers, universities, institutes that are all collecting the good practices and are willing to work with those countries that want to make a change.
Thank you very much, Natasha. May I ask our colleagues at the technical booth to project the online speakers for us, because I don't think we can see them, and so I can't tell if they want to come in or not. So it would be good to see. Perfect. Thank you very much. And we see Norbert already. Stay there. Don't go anywhere. We come to you in a minute. So we heard about best practices, this importance of countries recognizing that this is an issue. One of the questions from Slido that we saw earlier said, it feels like we're trying to pour from an empty cup. Like, how do we actually solve this problem? And the idea, I think, would be to think about also proactively how the changes that we might make now in working conditions and equality strategies, as we heard, and proper remuneration might actually work towards attracting new professionals to the job. And so what I would like to pose as a first question to you, Sidalia, is to reflect on that a little bit, on what we need to change to make the workforce professions attractive to new people joining.
Do you want me to answer now?
If you want to, yeah.
I think a lot has to change, but I think it depends on the health and care workers to make that change. So it's not only about others, it's also about us, and how do we frame the culture and the climate that we want to work in. But also I think leadership, as I said before, it has a key role on that. So those are my takeaways in the broad level.
Thank you very much. I don't know if Fanny Lara or Matej, you have something you want to add on this if you think about what needs to change when it comes to the workforce conditions. This is one of the main themes that kept coming back in order to make the professions, let's say, attractive again or more attractive for the future. Natasha is ready.
So if I may come in
Yes.
again. I mean, now I have three, not teenage, one past teenage, one not quite teenage children. And I'm always reflecting on what is it that the next generation see themselves as? Where would they like to work? What does their work day look like? What are their expectations? And I think increasingly we have a difficulty in that the health and care workforce is not portrayed as an attractive work environment that is in line with the expectations of the next generation. And then we're still, those who do embark on these careers because they have a set of values and ideals, find those values and ideals somewhat shattered by the grueling realities that they have to face and go through. And Matej was referring to this when he was speaking about moral injury. So I think there is definitely a role for transforming the way in which we deliver our health services and what roles we expect our healthcare professionals to play. And put simply, for example, let me refer even to the role of digitalization. Mm-hmm. The health sector has lagged behind in digitalization, but a lot of the digitalization that is taking place and the acceleration that we have seen also in the pandemic has not necessarily always worked for the benefit of the health workers. So I think that these are some of the issues that we really need to be talking about, and we need to hear from young people. What is the nature of work that would make it attractive for you to consider pursuing a career as a healthcare professional? It's challenging. We know that many young people now want to work from home. We know that in the healthcare sector that is often not practically feasible and possible. Mm-hmm. So I think we should not underestimate the scale of the challenge that we have ahead of us. But this should only force us to seek solutions faster, harder, and more creatively together.
That's true, and I think the together bit here at the very end was a key issue. I think we heard several of you talking about co-production, co-creation, really understanding what the needs are so that we can meet them. And as you say, Natasha, always those of us who go into health and healthcare come with an intrinsic motivation. And this needs to be nurtured and not completely destroyed by the fact that you have to work endless hours with no corresponding remuneration necessarily, with your work life impacting your private life and all these elements. So I think this is very important to consider, both proactively but also how we support the health workforce that is already now at the brink. And I think if I think about the 10 action points that you have in your health workforce report, there is a lot that spans really education to actually making sure that there are programs available to support at organizational level. There was a point that Josephine brought about the local level versus the top-down level. So basically this notion that if we bring in a policy from the top, then this might not be corresponding to the needs. And I think this all fits together quite well, and it fits well with your amplifying the voice first reaction to how we move forward. I do think the different types of engagement show us the possibilities, but I really also think that Natasha puts the finger on the wound, as we say, that we really shouldn't underestimate the challenge, and we really need a structured way to figure out how to tackle this as a whole. For our online speakers, try to give me a sign if you want to come in at some point so that I can bring you in. I think, Matej, you mentioned co-production earlier. I don't know if you want to give us a very short insight of how you see that happening.
Yeah, I think that fits very well with what you just ended with. So going from bottom to the top. You really need to listen to the needs and to find out what are the things that those in need really need, what they can use, and not just offer solutions that might not really be asked for. One personal experience was during the COVID. We offered personal psychosocial counseling to colleagues at the Institute. And there was very few people responded. And that clearly did not show really the needs that they were having at the moment. More, it showed that perhaps having to expose themselves, coming forward, speaking to someone, either in person or online, revealing their identity might have been bigger concerns that we have not taken in consideration at that moment. So that was something that we've learned by experience, and now we can do better. And doing better in this example means, reaching out first, seeing what is the most appropriate way to help in specific situation. I think that would be it.
Thank you. I think this is also quite important to consider what it would look like if you were working in an institution that sort of mandated you to seek out this type of help, as opposed to, for example, leading by example from the leadership of the institution to take part in such an intervention first. But these are all really tangible things that need to be worked out, I think, as you say, by actually putting effort into that and going into research, also as Sedalia was talking about earlier. We have discussed this now to a degree, the extent to which a top-down policy or a bottom-up approach, or both, play a role. We come to a part of the session where we think about quite a top-down approach to things. So I would bring in Norbert Kuspel at this stage. Norbert, you are the lead of the Committee on Future-Proofing Health Systems of the European Health Parliament, and I think you came together to discuss how that actually might happen. And you have some questions for our participants and will enlighten us about what you thought we might do for future-proofing health systems, particularly in reference to the workforce. So over to you. Give us a bit of an insight on what you worked on.
Yes, thank you, Dimitra. Good afternoon, everyone. Delighted to be part of this session today, although unfortunately I cannot be there here in Gastein. So indeed, this session on really this crucial topic of basically the future of a health workforce from a perspective of its mental health in particular, actually started indeed from the work done by our Future-Proofing Health Systems Committee at the European Health Parliament. So I'm very happy to see now this great discussion taking place, and thank you very much to the Young Forum Gastein as well for making this happen through this collaboration. And I will also be sharing some perspectives from another committee of the European Health Parliament on well-being of healthcare workers, which is obviously very relevant to the session today, as they also kindly provided support for the preparation. So Sedalia has been part of this work, as well as also many colleagues you have seen, some of whom you have seen some videos from, and we're also very honored to receive support from policymakers, stakeholders across Europe, and also to benefit from advice from some leading institutions and experts, actually including Natasha on stage today. And actually, for those being fortunate to attend the forum in person, I think there is a QR code somewhere in the room, which is actually allowing you to directly download the whole EHP7 policy book, but otherwise you can also find it at healthparliament.eu. So we have just heard a very insightful discussion indeed on the mental health challenges faced by our health workers across Europe, from Chidalia's and Fanila's personal experiences, Natasha's institutional perspective, and Matej academic expertise. During our work at the EHP to delineate policy recommendations for the future of health in Europe, we strive to tackle these issues in really a holistic manner, which means both, of course, outlining practical solutions to support health workers on the ground, so this is more like the bottom-up approach, but also importantly, looking into means to address the root causes of these issues. And so regarding these root causes, our stance is the following. not only can there not be healthy patients without healthy workers to care for them, including in respect to its mental health, but there also cannot be healthy professionals within non-resilient, overburdening health systems. And so as explained by our panelists, and although mental health issues are always multifactorial, health professionals' overwork is pretty much always part of the equation. And as these gaps appeared clearer than ever during the COVID-19 pandemic, but are somewhat being overlooked in the responses provided to it, we believe that indeed now is the time for action. So this is based on these firm beliefs, as well as all of the insights we have heard, that we would not like to hear from all of you in our audience about the solutions we can bring forward to achieve strengthened resilience of health workforce systems as a means precisely to tackle health professionals' mental health in the long term. And so this will happen through a Slido poll. So I will now kindly ask colleagues from the technical team to open the first question, which I hope you can see on site. So for on-site participants in the session, you can directly scan the QR codes, which should be visible on the screens right now in the session room, or go to slido.com and insert the codes #MOON, MOON, in order to access the open polling questions. And for online participants, the open questions can be seen on the right-hand side of your screen. So I hope you see now the first question. So our first question is, do we need a European action plan for health workforce systems resilience to address health workforce mental health issues and their root causes? So as you can see, the key concept of this first question is to ask you about this idea of an action plan. And while you are voting, maybe I can explain basically the three key reasons for us to believe that this is needed. First, in a way, there's a motive. We do not believe that health workforce organization is purely a national matter. It's actually intertwined deeply with EU-level policy. A simple example, health workforce shortages are, as we know, critical drivers of mental health issues for those who chronically cover for them, as we heard. And they cannot be seen in isolation from free movement of workers, which is in itself a key achievement of the European Union. So we think that if the EU wants to be serious about bringing equity and solidarity for a true European health union, then European action on health workforce systems resilience must be part of it. Second, the means. So although they were brought at the forefront by the COVID-19 pandemic, these issues of health workforce shortages, medical deserts, and their consequences on health workers' mental health are not new. Yet they were never really tackled in depth at European level. So we think that an ambitious, dedicated EU policy initiative could provide the momentum we need for that. And we are glad to say that actually some leading European stakeholders and policymakers, including some MEPs, already support the concept. And third, the opportunity. As many of you may be aware, the European Commission recently published its proposal for a European care strategy, which includes recognition of many of the issues we discussed today, but somewhat incomplete addressing of them. And so we believe that the action plan could actually be part of strengthening this strategy during its implementation. So I will now maybe ask for your help, Dimitra, on seeing the results, because I actually cannot see them from my end. Yes, I can see. We have 83% of positive, which is great. Dr. Dimitra, if we can call on some reactions, maybe some quick reactions in the room at this stage.
I cannot see a lot of reactions, Norbert, and I think the results speak for themselves in a way. Of course, we have a very large share that says yes, absolutely, EU action is critical. I mean, you explained the background to us in a way that also encouraged this reaction, I think. But the 17% that say no, the right level of action is national, perhaps reflect really this need for an international agreement on some things, but the real need of national level policymakers to take tangible action to encourage this sort of initiative. So this is what I would surmise from the results. Perhaps we move to the next question in the interest of time, and I think we only do the next one, and then we wrap up. Not the session, just this part of it.
Thank you, Dimitra. Indeed, interesting to kind of see reflected in the audience really this mixture between the European and the more national approach. So indeed, the second question, so now that we know what the action plan could be, and now that for most of us we think that an action plan could help, of course, to reinforce what's happening at national level, etc., what should be in it? So we were not short of ideas, and you can see for all of the participants, so we have a couple of ideas of what could be in there. And so what we would ask you to do is basically to pick your favorite one. And to help you while voting is happening, happy to basically explain a little bit more about some of them. Maybe the first one, European Health Workforce Registry. So this is also coming back to some of Chidaya's point and some other speakers on the session about data. And in this case, about really providing the European Union with a clear role on mapping, planning and forecasting with respect to its health workforce, which would really help foster data gathering to support a more coordinated approach across Europe. It has been advocated for many times, but never really happened yet. And of course, this registry would connect to what's already existing. We know that the WHO, thanks to Natasha and many other colleagues, already worked on national health workforce accounts. And we really believe that this could help trigger a more equal distribution of a health workforce across Europe with less overburdening and mental health issues as a result. Second point, more to the national level, how can we support what's happening locally on recruitment and retention? It was highlighted by many of you on the panel. We need to keep health professionals in the profession and also in the country, in the countries where they are trained. In this case, we're thinking about a new funding mechanism, basically a European Health Workforce Fund, for instance, under the EU for Health program, as a way to support the good initiatives at local level more prominently and to help, again, eliminate overburdening and mental health issues as a result. And maybe before closing the voting as well, the strategic corps. In this case, it's more targeting the crisis times. We have been going through the COVID-19 pandemic as well. And so basically, the EU has this civil protection reserve of resources called RescEU to protect citizens from disasters, emerging risks. And in the health area, we see medical stockpiles, medical equipment, personal protective equipment, but we don't see a proper health workforce component in this reserve. And so this is why we were basically proposing to create one and to see how this strategic corps could help avoid the adverse consequences of any health crisis, being it a pandemic or another crisis, on both patients' health and also, of course, health workers' health, including on the mental aspects. So now, Dimitra, I think we can check the results.
Just maybe one thing. I don't know if we've closed the voting yet. I don't think so. Those were not, as Norbert, I think you mentioned, well, almost. Those were all recommendations that build around the system's approach towards the workforce. They were not all explicitly related to mental health directly, right? So this was about building a resilient health system around the workforce to ensure that we can have an amplified well-being, and within that, perhaps better mental health. What we see now when it comes to the results, and I think you can see them as well, is the very first or the highest scoring one is best practice sharing. And I think this, for me, working with the European Observatory on Health Systems and Policies, this is music to my ears because this is what we do. So I can understand that this is really, really an important component, and our commitment, of course, in this area is taking that forward. My colleague Matthias Wismar, who is not here, I think, I will have words with him about that later, is working in this area of workforce and skill mix, so we have a number of things going on there. We see supporting local recruitment and retention initiatives at about 15%, coupled with European recommendations as national health workforce systems. So here we have both the overall recommendations that give us perhaps the possible ways forward, and then really the local implementation. And this reflects also quite clearly what we were talking about just before that. New strategic European core of health professionals for crisis response. This is, I think, specific to what happens when we have an external shock to the system, like the pandemic. We know that we have shocks that are perhaps more chronic. We have shocks that are upcoming, like climate change, for instance. So this seems to be also reflected in your opinions. European Health Workforce Registry, Also, in relation to professional mobility, I'm thinking, which has here a whole new session to discuss how we handle that and whether that's good or whether that's good for some countries, but bad for other countries, and how we can balance that takes a lot of discussion as well. Upskilling via training programs is only at 8%, I think, which is interesting, Natasha, because this is one of the core components that we've been thinking about as a rewarding option for the future, and perhaps also a way to tweak skill mix. And for the last one, which was strengthening, maybe we have the results again, if that's possible. I have them, I think, here as well.
The working time directive.
Yes. I don't have them anymore. That's okay. So the last one we did, we were not able to see the share of answers, but I'm guessing, based on the geometry of the slide, is less than 8%. The implementation of the European Working Time Directive, which, if we think back to what our speakers have been talking about, is also a bit surprising that it didn't score higher, I would expect. It is interesting because the implementation of the directive is quite different in European countries. We had the discussion on the Greek implementation a few years ago, where we found that it was not really implemented properly, and that created a lot of problems and a lot of issues. So this is also something to consider. Norbert, coming back to you for a final word on this, how does that reflect what you expected when you posed these questions?
Thank you, Dimitra. I think it's very interesting input indeed. As you were describing, it's really reflecting this mixture between top-down and bottom-up, I think. So basically supporting what's happening at local level, the countries sharing about the best ways to handle the problem. I think it already comes back to what Natasha was describing as well. All of the countries expressing the same concern, and they need to share. And I think it was a bit like a permanent theme throughout the discussion, but also kind of the top-down, especially kind of picking these recommendations on health workforce systems at European level, using the mechanisms in place. So I think it kind of shows that everybody should be at its place, that the EU has a role to play, countries have a role to play, and everyone should talk to each other. So yeah, very interesting, and thank you again for the opportunity.
Thank you very much, Norbert. I think that what's interesting for me also is links to something that Natasha hinted at earlier about the needs of the young people. The European Health Parliament is the voice, maybe not the only voice, but a strong voice for young people in the health and healthcare sector. So I think it is quite interesting to see that it goes very much along the way of what I also read in your report, Natasha. So I don't know if you want to have a first reflection on the results before we go back to our audience.
Thank you, Demi. So I think basically, as you say, in spite of the fact that there is just so much information out there, there are a lot of good practices that don't necessarily get written up, but are just implemented. And it's only when we go to look for them that we find them. And many times those are actually at local level. One has to be careful. They don't automatically scale up. You have to pay attention to the culture and the context. So I think a combined approach of having a push and advocacy and funding and resources and some initial investment at European level can help. But then it's also about how you build that through the grassroots bottom up. In terms of perhaps what didn't score so high, well, what can I say? I mean, the European Working Time Directive has been in place a long time, and yet at the same time, if your back is against the wall as a health services manager, and you have to provide services, it's not a nice or comfortable place to be. And increasingly, this is where many hospital managers, many nursing home managers are finding themselves. And it's a reality that we have to acknowledge. So I think this is why people almost feel, okay, the directive is there, but it's actually having the people on the ground to be able to allocate, to deploy, that makes a difference. And then coming to the upskilling and the training, I think they are two different things, because sometimes we tend to put everything, or we try to put all the solutions in terms of career pathways. I mean, the health sector is what it is. There are some roles that require very specialized, narrow, advanced practice care, but the bulk of care is the bread and butter, general nursing, general practice. I was in Barcelona last week, and one of the heads in Barcelona was saying, we have a problem. Nobody wants to do general practice any longer. Everybody just wants to become a high-tech, narrow specialist. Is this maybe because they have the chance to interact with gadgets? And this is what young people do all the time, interact with gadgets and technologies. So the option of being in a high-tech environment where you hardly even see the patient because you're always interacting through technology is far more appealing than sitting somewhere where you just talk to people and listen to people. Again, I mean, do young people actually spend much time talking, or is it all texting nowadays? I think these are some of the questions that we really need to challenge ourselves and ask ourselves. So, you know, it's fine to sort of stop at the superficial level of leadership, training, but we need to start unpacking and asking some of the more uncomfortable questions.
I think, thank you, Natasha. I think this is really useful, and this is exactly sort of the knife's edge that we are on, because, of course, if you're from the managerial perspective or the need to provide services, you need your health professionals to provide the services, so you're going to ask them to work more hours than they normally would, and we see that as one of the typical responses in the pandemic of how to actually ensure the dual provision of services for COVID-19 patients and non-COVID-19 patients. And at the same time, this is one of the main issues that we've heard about from the root causes of poor mental health among the health professions, that we actually have too much work, unstable work hours, unable to take time off, not really recognized in terms of financial compensation. So this is really a very difficult place to be in, which is why we're here, and it reflected in this pouring from an empty cup comment that we had in the first round of questions. Before going back to our other speakers, I would go back to Josephine to ask if we have any additional burning questions from our audiences. We've had it so far that we've taken questions digitally also from people in the room. If you're in the room and you have burning questions that you cannot put into Slido, just flag me and I'll try to pass you the microphone anyway. Yes.
Thank you very much. So among extra contributions that have come in, one comment was higher wages and more responsibility and recognition of nurses should go hand in hand with continuous and educational support and training. One other question to jump in, and I think it started being addressed, digitalization, right? We know that, first of all, digitalization is not going anywhere. We know it's not a cure-all. However, how can we leverage digital tools to support the mental health and not impede it? And I think that's one of the questions. I'm building on one of the simple questions, but adding elements to it. Thanks.
Thank you. So digital tools contributing to well-being of the workforce or detracting from the well-being of the workforce. We'll come back to that in a moment. Sidalia, I will ask you to weigh in. I'll ask Matej to weigh in on whether their intervention that didn't really work very well with their colleagues would have worked better if it was an app on a phone. And I'm going to ask Fanny Lara to talk about her experience with perhaps digital tools in the mental health area. Before that, we have one participant in the room, two participants in the room with questions that I would like to be able to take. And Josephine, I think, can do that with the microphone. It's easier here in the front. We have one here and one in the back. Very briefly, thank you.
I don't know, I try.
Briefly.
I'm the Austrian president of the psychologists, and I'm a member of the European Association of Psychologists. We are 100,000, so we are really mental health experts. And I worked for 30 years within a hospital. What I wanted to say is that we have not really go back to the start, because there are clinical psychologists in each hospitals working together with the health professionals, with the nurses, support them and work together on the same level. What can we do to relieve and to help, especially now in the pandemic? And we do now have research a lot. We don't need really new research, but we really know that the health professionals are the ones on front, especially women who suffered most. And secondly, the youth. And I really want to thank you, especially WHO, because the saying that there is no health without mental health, we couldn't do better. So we should address mental health as a diamond of health, and we should put it on top of all our thinking, because there is no other way. We all are dealing each minute within emotions and mental health. So it's really, really a very major issue if we're talking about it. And last not least, I would like to mention or to address what we really have to do in future is we have to address mental health as an issue of health literacy. Because if Laura or you, if you said you would ask for help, people have to know what mental health is all about. And I think there's a lot to do. We have to address the issue of health literacy, especially when we talk and think about mental health, because nobody really, or the population really don't know what is anxiety disorder, what are the first signs of depression, of suicide, etc. There we have to work on this globally, I think. Thank you very much for listening to me.
And before you give up the microphone, I said briefly, Josephine, just a second, but just a question from me back to you. Yeah, so if you work at the hospital, right, as a clinical site, worked at the hospital as a clinical
I'm the president of the Austrian
Yes.
Psychology. I worked, because now I'm pension, if you look at my face, so I'm not in a hospital anymore, but I was for many, many years working in a hospital, yes.
So my question for you is, if we think, because you talked about mental health as health literacy for the population,
Yes.
if we think about mental health for the health workforce,
Yes.
and you come from within and you work, what is it that we need to do at that level, at the organizational level, to help with mental health of the workforce?
Yes, we have, especially in Vienna, the Austrian Association of Hospitals, high up policy. We have especially lessons or health promotion groups within the hospitals for the health personnel, and their mental health is part of. So if we talk about health, mental health is part of the program. And I think that we should think about, that we implement health promotion in workplaces and workforces. We just implement the issue of mental health. It's easy, I think.
Okay. I don't know if it might be simple, but not easy. We'll see. But I think Austria might be one of these situations of best practice exchange for that type of thing. Good to know. Thank you very much. Final point from our colleague in the back.
Thank you. Leopold Slani from UCL's Institute of Innovation and Public Purpose. There's a line of argument that suggests that a lot of care work is done at the home, as the other question also went, mostly by women, and it's never been measured, it's never been remunerated. And so the question would be, what kind of policy initiatives could support this kind of work better?
The informal health workforce. Okay, Natasha, I see you're already reaching for the microphone. You want to say something?
I just want to say that actually this is really one of the gaps, and we acknowledge it up front, that in our health and care workforce report, we do not have any data on the informal and unpaid care work that takes place at home. So I hope that also now with the European Union care strategy, this could be an area where we can shine a light. I think the purpose of our health and care workforce report was to shine a light on, we covered 6 professionals, not even the entirety of the workforce, but I think the point that you make is very relevant, and I acknowledge that we haven't yet been able to shine a light on it.
I think we were hoping, no more time for any more questions, I'm afraid. We're going to have a coffee break right after, we can discuss them. You can take your seat. We were hoping to have more time at the end for discussion and to focus on this whole of society approach to mental health in general and to the mental health of the workforce in particular. So I'm not going to ask our panelists any of the questions that I said I was going to ask them before. I'm going to ask you for your takeaway messages based on what we have discussed, what you have heard from each other, from our audience, from our participants in the video. How can we foster the mental health of our workforce? For the whole of society, we need another session. Moving forward, based on what you've heard today, what are your takeaway messages? And the way that I would like to do this is we start with Sidalia as for the session, we go to Fanny Laura, to Matej, and then with Natasha. So Sidalia, over to you. You heard a lot of things in addition to what you thought. Give us your final takeaway message.
I think we have to all work together to enable a change in policy and a change in our health systems to drive the mental health and the well-being of the workforce.
Very good and very concise. Thank you very much. So, Fanny Laura, over to you. Takeaway message for today?
The treatment I've received is priceless, but the price that health professionals are paid, the salary, the job that pays is not. So I say, in order to get more appealing to the health workforce, we need to pay them more.
Okay, so very clear, very loud, financial compensation, appropriate financial compensation. Matej, we come to you. Takeaway message for today?
Well, I would say we need to sit down more often, talk about things, address them as they are, and see where we can move forward.
And always with the engagement of the health professionals themselves, I'm assuming.
Most definitely.
Very good. Thank you. Natasha, final word to you.
Act on the data, make this a visible problem, promote, protect, restore mental health. And just coming from 2 flights, we are always told, first wear your mask before attempting to help others. If we want our health and care workforce to be fighting fit, to be able to help others, first and foremost, they need to help themselves. Thank you.
Thank you very much. We take the messages, promote, protect, restore, as the final words for today. Thank you very much to all of our speakers. Thank you very much to our co-organizers of the session and to all of you for being here. We wrap up here and we see you all outside for a cup of coffee. Thank you very much.